My name's Dr. Chris Milkie, and whether you're checking us out for the first time or whether you're a loyal patient of ours, I'd like to welcome you to Milwaukee Foot Specialists. I've been in practice for 20 years. I'm one of the partners in the practice. My office is in the Mayfair area, and I enjoy what I do. I've been treating all foot and ankle problems for 20 years now, and it's been an absolute pleasure meeting and treating the patients that I've seen over the years. Even though I do everything, I do enjoy doing a few things more than others. I treat heel pain, ingrown nails, bunions, warts, children's foot problems. Those are the things that I enjoy the most. There are so many different problems that can affect the foot, but those particular things are the things that I tend to see mostly and really enjoy getting people back up on their feet. One of the things that I found over the years is the fact that a lot of people don't even know that something can be done for their foot problem. They've been living with the problem for 6 months to a year, and finally they get to the point where they're desperate and they ask a friend, a family member, a neighbor, maybe even their doctor, you know, what can be done for this, and finally they end up in my office, and it's just an absolute pleasure being able to see the joy on their face when I tell them and they experience the relief that they get from the care that we give them. I believe in practicing non-surgical care first. Certainly there are times when surgery is the only option, but in most cases we can get people better without doing surgery on them. Some people have conditions that may take a little bit longer to get rid of the problem, but we can get people back up on their feet pretty quickly. Rarely do we have to take people out of work for the kinds of things that we treat. We like to get people back, exercising and doing the things they'd like to do on a consistent basis prior to when they had the foot problem. One of my philosophies is that when a patient walks out the door feeling better, I don't believe that that's the end of our relationship. That's really the beginning of our relationship, because we do ongoing education. We send newsletters to patients. We're constantly educating them on how their feet can stay better, as well as passing that on to their friends and family and co-workers, because the message is an important one. You don't have to live with foot pain. We can get you better. We can get you better fast. We can keep you exercising, and when your feet feel good, the rest of your body feels good. And not only do foot problems hurt, but they can also lead to other conditions such as knee pain, back pain, as well as, if you're not exercising, it can lead to high blood pressure, diabetes, and a whole number of other systemic problems that can affect the body. I'd like to thank you for checking us out. Hopefully you found some information that's useful to you, and we would be more than happy to see you in the office and welcome you into our practice. And when you come in, you'll become part of the Milwaukee Foot Specialist family.